Hello everyone, Dr. Bradford here at Downtown Gilbert Healthcare. Sitting down with Dr. Dan, talking about something called the Therapeutic Order. Therapeutic Order. So, Dr. Dan.
Yes.
Do you know anything about this?
Therapeutic Order. 7 categories of how we think that patients should be treated in a specific order where drugs and surgery are not the first line of attack.
Yeah.
So Doc, explain.
It's a good summary. So the Therapeutic Order is something that was put together by a couple of naturopathic doctors back in the late 1990s. These doctors have been practicing for several years and tried to put together kind of a framework of how does a naturopathic doctor approach a patient.
Okay.
So 7 levels. When I explain it to a patient, I put it like a ladder.
Okay.
I've seen it drawn like a pyramid, but a ladder, climbing up, getting more aggressive and more of an intervention as we go up. So at the baseline, we talk about something called removing obstacles to cure, meaning getting those things out of your life that are preventing you from being able to heal.
Such as
your diet, your sleep habits. Maybe it's a job that you're super stressed out about. That one's a little tougher because we can't necessarily tell people to quit their job, but
toxic relationships
yeah.
men and women, wife, boyfriend, girlfriend, boyfriend, boyfriend, or even amongst parents and kids.
Yeah.
And
Absolutely.
even divorced parents and new spouses and kids and dynamics. Lots of different issues there.
Oh yeah. So all of these things can become obstacles that we need to move out of the way or get over in order to start some healing.
Now let me ask you, Doc, if we can, any of the things that we're going to talk about in this 7-tier ladder, can any of those overcome toxic, stressful issues? Or is that baseline because those have to be addressed first and they have an effect on the rest of the outcome?
I think ultimately they have to be addressed first.
Okay.
An analogy that I always use, especially if I'm sitting down with a diabetic patient,
Sure.
kind of the conventional approach to diabetes is medication,
Sure.
right? Very little, if any, focus is put on the diet or lifestyle changes, that kind of thing. So for me, those are the obstacles to cure a lot of times.
Okay.
So I build this analogy of like a burning house. Okay, diabetes causes a lot of inflammation, which causes a lot of pain and symptoms. And so if you picture this burning house, medications are like that fire hose. So you're standing there with this fire hose. So you're trying to put out this fire, and at the same time you're throwing wood on the fire with all of the lifestyle things that you're doing. That package of donuts, that banana every day, every meal, blah, blah, blah. So we can't put out that fire unless we stop putting that wood on the fire.
So as an example, when we have diabetes and we know that any sort of heightened inflammatory reaction will cause an alteration, a negative impact on the body's ability to handle the blood sugar due to the cortisol production, the body's way of handling stress. So if you are doing lots of medication, but you aren't addressing the stressors of your life, then those will have a poisoning effect on the actual treatment that you're prescribing.
Yeah.
Okay.
So if we remove those obstacles, then the medication works better.
Right.
Then eventually we can taper off some of that medication.
You got to get your life in order, and you got to get that stress down.
Yeah.
Okay.
So that's the baseline. The next step up on this therapeutic order is what we call stimulating the self-healing of the body.
Okay.
So we know as naturopathic doctors, that's kind of core to our philosophy, is that the body can heal, that we have this innate ability to heal.
That's great.
Everybody's cut their finger before, right?
Don't have to tell your finger to heal up. It just
Right,
does
it
it
just
automatically.
does it, and a lot of times you end up, without a scar or anything,
Sure.
and you can't even remember that you cut yourself. So that healing ability, that's not restricted to just superficial cuts and scrapes and that kind of thing. Our bodies can heal. We can heal from debilitating disease. We can heal from emotional problems. We can heal from any number of issues. And so doing therapies that can help stimulate that healing, stimulate that body's ability to heal, those can be really powerful.
So, looking at it, is this kind of where diet and exercise kind of come into?
Sure.
Where it's trying to streamline the body's ability to be healthier?
Yeah, if we can get the digestive system working really well, that can improve mental health, that can improve your ability to lose weight. So that's just like one example. Other therapies that can stimulate your body's ability to heal include like acupuncture, homeopathy, doing a homeopathic remedy that matches the patient, kind of working on a different level, engaging that mind-body connection, which can be really powerful.
Hitting the meridians.
Yeah.
Okay. Done. Third tier.
Next level up is strengthening weakened systems.
Strengthening.
Yeah.
Dr. Dan likes strengthening. Okay, so talk about strengthening weakened systems.
So, for example, we do a lot of hormone work here, hormone testing, hormone balance. If that hormonal system is weak or damaged or not balanced, not optimized, then a whole bunch of other things are going to be out of whack.
Correct.
Right? You won't be sleeping good, you won't be making good food choices, it'll be difficult to lose weight, brain fog, just not in a good mood. So if we balance and tonify those systems that are weak or damaged, then the dominoes start to fall.
Now, this is also important because back in the day, when we were testing hormones, we'd just do a blood test and we would see like free testosterone, total testosterone, estrogen, progesterone. But now we know that there's different metabolites of those hormones. And when we have a dominance of one metabolite over the other, sometimes that sets us up for failure where it can cause different issues. So we can't just anymore, the old school way is get a blood test and see, oh, my testosterone is low, so pack you full of testosterone. We have to know what that is actually doing in the body for men and women.
Yeah.
And trying to prevent some of these cancerous type of environments where cancer will thrive.
That's right. Yeah, so with the type of testing that we do here, we can see kind of the complete picture of all of your sex hormones. How does the body break it down? How are you converting to estrogen? What is the body doing with that estrogen once it's kind of at the end of the road? At a certain point, estrogen is kind of seen as a toxin by the body, and it has to be detoxed. It has to be broken down and properly eliminated. So with the testing that we do here, we can detect that and see, what's your body doing.
This reminds me of back when I used to do the radio show, and I would follow when the estrogen, the different estrogen replacement therapies, and it was fascinating. Over the 12-year span, they would continuously have these studies that would start, and they would always end early due to the fact of the predominance of estrogen therapy causing breast cancer.
Yeah.
Which is very interesting.
Yeah.
And I never saw, doctors, medical doctors would not necessarily change they wouldn't follow the research just because, you got a patient, it's like, hey, I got hot flashes, I got this, I got that, and they only have in their medicine cabinet, well, let's just give you hormones because you're low, but they weren't educating the patient about some of the deleterious effects that can happen.
Sure. Yeah, so this idea of correcting or tonifying weakened and damaged systems, we can make a lot of progress that way. The next level up on this therapeutic order, something that you're going to like, that you do all day long, correcting structural integrity. Fixing and modifying the physical body.
Okay.
Whether that's a spine that's out of alignment, a foot drop, a leg that's shorter than the other, that our body's going to compensate with our physical body, right? Our goal is with our physical body is to stay in balance, straight up and down, front to back. We're not leaning too far to one side or the other. So correcting structural integrity of the body is key.
Well, this is how important it is because anytime when we're talking about overall body inflammation, an altered structure, something that is not in perfect mechanical alignment, will cause inflammation. And we see that and it's very easy to prove, when we will see one spine, one pelvis, one hip, couple of hips, couple of knees, couple of shoulders. Why do we always have arthritis that might be at the, one part of the spine, but you go an inch above and there's no arthritis seen?
Yeah.
And we know that anytime when someone loses the neck curvature from an auto accident, that will cause arthritis within about 3 years. Starts to create a big hump in the back.
Yeah.
We know that if we have, this is a very classic thing that I'll see with my bodybuilders and my weightlifters, my CrossFitters, is that we know that anytime when the